Hi, and welcome back to another Elder Watch series. Today we'll be continuing our coverage on long-term care planning, and we'll be answering a question that a lot of people have when it comes to long-term care planning, which is, does insurance cover it? Let's talk about it. This presentation series is brought to you by Elder Watch, a 20-plus year partnership between AARP and the Colorado Attorney General's Office. Among other things, we work to fight the financial fraud and exploitation that Coloradans 50 plus might experience by providing educational presentations and supports. We also do events like shredding events. We have a podcast. We do this web series, and we go all around the state. But we also have a volunteer staffed fraud victim support helpline. If you or someone you know might be the victim of a fraud or a scam, or maybe you placed an order for a puppy on Facebook and now you haven't seen the puppy yet and you're getting hundreds of different claims from the vendor and you're like, what is happening? Give us a call. Our phone number is 800-222-4444. Select option 2. And just so you know, that was an example of a pet scam. So if you have one of those or any other scam or someone you know you're concerned that they're involved in fraud or scam, like I said, give us a phone call. We would be happy to help you out. This is the third topic that we'll be covering in this long-term care planning series. If you've missed our other videos, we have talked about first options and acronyms. So going over some of the jargon as well as some of the options available when it comes to long-term care planning. After that, we talked about considerations and questions that you might want to ask when evaluating a long-term care facility, as well as when deciding what type of long-term care you or your loved one actually needs. Today, we'll talk about insurance coverage, particularly Medicaid and Medicare, when it comes to the 14 options that we outlined in Portion 1, Options and Acronyms. And then next time, we'll talk about how to pay for things that insurance doesn't cover. Personally, I think that Medicare and Medicaid sound too similar, making things a little bit more confusing in an already complicated situation, but I'm not in charge, so I guess those names are here to stay. But to kind of illustrate the differences and similarities, they're both health insurance programs. Medicare is health insurance for those who are 65 and older, whereas Medicaid is health insurance for individuals, families, and children who meet certain income requirements. So to be eligible for Medicare, you must demonstrate your age. To be eligible for Medicaid, you must demonstrate income under a certain amount. Now, it is possible to be enrolled in both Medicare and Medicaid, and a spend down to become eligible for Medicaid once you're on Medicare might be part of your plan for financing long-term care. So let's talk about what a spend down is. Having both Medicaid and Medicare in some situations might be advantageous, but as I mentioned previously, getting Medicaid has income restrictions. So to be eligible and to use that for financing long-term care, you might consider a spend down. Essentially, this means spending down your income and resources, often by private paying for long-term care, until you have spent enough to become eligible for Medicaid. Now, if you've been part of other Elder Watch series and videos, you know that I am not here to offer you any financial or legal advice. So if you decide to pursue a spend down in part of your long-term care planning, definitely consult with a financial legal expert before you do that, because there is a lot involved in that process. Now, we here at Elder Watch, we are here in Colorado, and at the time of this writing in Colorado, to be eligible for Medicaid, you, as a household of one, must have income and assets before taxes under $20,030. If you're a household of two, you must have under $27,186 before taxes. However, because Medicaid and Medicare do not always cover the same services, this is why you might want to do the spend down. I do want to note that particularly for facilities that are more residential in nature, it's not a requirement for a facility to have a Medicaid bed. So when you do a spend down, you're doing it so that you qualify for a Medicaid bed. That's why it's important to ask those things, particularly about whether they have Medicaid beds, before you get to a location, because if they don't have a Medicaid bed and that's part of your planning, or rather if they don't have a Medicaid contract and you think that might be something that you need, then that facility probably isn't going to be a good match for you in the long term. This is part one of the Does Insurance Pay For It portion of the long-term care planning series. And as we discuss the 14 different options that we talked about in that options and acronyms presentation, you'll hear me say that it is likely or unlikely that things will be covered. And I'm saying it that way because there are always exceptions and things are always changing. As a result, it's very important to learn as much as you can about your options and coverage for whatever state you're in and for your particular circumstances, because these things do vary. Today we'll focus on the top half of my, if I do say so myself, nifty little diagram. We'll be talking about short and long-term care with a lower level of assistance and how Medicare and Medicaid might support you paying for that. In this matrix, you'll see that I have color-coded all of the 14 options, and I've color-coded them as red, likely covered by Medicaid, blue, likely covered by Medicare, purple, likely covered by both, and orange, likely covered by neither. So let's jump in. I want to talk briefly about custodial care. It's not itself necessarily an option that we've talked about, but it might be a factor in some of the options we've talked about or some of the things that you need. And custodial care is generally understood to be non-skilled personal care that helps people with chronic illnesses or disabilities with activities of daily living. So if you missed options and acronyms, activities of daily living, or ADLs as they're called, are the things that we need to do to survive. So think eating by yourself, using the restroom by yourself, things like that. Now, with custodial care, this is an ongoing need, and it's often a huge piece of why individuals are leaving their homes in the first place. Unfortunately, this also often incurs significant room and board costs when you are using custodial care, but custodial care is not something that Medicare will usually pay for long term. We'll get into some of the ways that Medicare might be able to offset this a little bit later. On the other hand, Medicaid is more likely to cover a large chunk, if not all, of custodial care, so long as it is provided in a Medicaid-approved facility or a facility that has a Medicaid contract. So with Medicaid and Medicare, it's very important to understand your individual care needs because, for example, you might not need custodial care, so this might not matter to you. But if you do need it and you don't have Medicaid and you only have Medicare, things out of pocket might be a little bit pricier than you would anticipate. So let's start by talking about short-term, lower level of assistance options and how insurance helps to support you if you need those services. So for our first short-term, lower level of assistance option, we'll be talking about LTACs or long-term acute care. Now, if you missed options and acronyms, consider going back, because when I say lower level of assistance, I don't mean that you're not particularly getting medical care treatment. I don't mean that it's kind of like laissez-faire. I mean that it's for a condition that is expected to improve and or go away. And when I also say lower level of assistance, I mean that it's for someone who can generally meet their ADLs or will be able to meet their ADLs and who doesn't need constant monitoring for their safety. So when it comes to long-term acute care or an LTAC, both Medicare and Medicaid can likely help you out, though there are restrictions and potential copays. Now, so a SNF or a skilled nursing facility is another step down between the hospital and going home. And good news, Medicare will likely cover your stay in a SNF so long as you meet all of their conditions, which you can see listed on this slide. I do want to bring attention to what a qualifying inpatient stay is when we talk about SNFs. And so a qualifying inpatient hospital stay means you've been a hospital patient for at least 3 days in a row, counting the day you were admitted as an inpatient, but not counting the day of discharge. Medicare will only cover care you can get in a SNF if you have this qualifying inpatient hospital stay. So again, this is why it's really important to understand that nuance. Medicaid is also likely to help you pay for a sniff, but again, it's important to check eligibility requirements, how long they will pay, and understanding what, if anything, will be your financial responsibility. I did mention in options and acronyms, but I think it bears repeating that home health may be a service that you seek for different reasons for a different period of time. But in this context, we're talking about it as another step down from the hospital to help you get back to your normal level of function, or again, return to a lower intensity long term care option. This can be a great support in that hospital transition, and it is likely that Medicare will cover the cost of an in home health aid. Now, I won't go through all of the nuance, but of course, it's important to understand what Medicare will and will not cover. And very importantly, Medicare, for you to get their help with paying for this, requires you to be homebound, meaning that essentially you have difficulty leaving your house by yourself, and it's not medically recommended that you do leave your house by yourself. And I also want to note, when it comes to home health, it can be a great option because I'm sure many of us would rather be in the comfort of our homes versus a more clinical setting. But it is important to remember that some of the things that you might need help with that aren't medically necessary, so those IADLs, like preparing a meal or doing chores, they probably aren't covered by a home health aid. So pros and cons to this option, but good news is that Medicare can likely help you out. Now, at least in Colorado, Medicaid is likely to help you pay for home health services. As always, it's important to ensure that you investigate coverage and do not assume that Medicaid or Medicare will cover your specific situation, because as you've seen on some of these screenshots that I've taken from the Medicare and Medicaid website, there's a lot of nuance, there's a lot of specificity that goes into whether you'll be covered or not. So again, that's part of why I keep saying it's likely. So make sure that you do some research to ensure that your specific situation is covered. That said, generally, it is likely that Medicaid will help you pay for a home health aid. All right, so we've covered our three shorter term, lower level of assistance and how Medicare and Medicaid impacts payment for those. So next, let's get into long term, lower level of assistance options. All right, so before we delve into this section, it's important to remember that Medicaid and Medicare are health insurance programs, they're not housing programs. And as a result, that means that Medicaid and Medicare will not always pay for room and board when it comes to specific situations. And particularly with independent living, things might not be looking so great. So because independent living is not considered medically necessary, it's therefore not something that health insurance would cover. And as a result, it's not likely that it will pay for room and board in independent living, which are, of course, a very significant expense. That said, if you develop physical or mental health needs that make meeting your ADLs independently more difficult, Medicaid may be able to help. So they may be able to help with the health services that you need, but they likely won't be able to help with the other things that are part of independent living, like room and board, activities, transportation, things like that. And then very similarly, like Medicaid, Medicare also does not pay for independent living, at least those room and board and non-health related things that are tied to it, because they're not considered health-related expenses. So CCRCs, or continuing care retirement communities, would be next on our list for long-term lower level of assistance, but we're not actually going to delve into them because CCRCs are generally a collection of services that are housed within a single campus, community, whatever you want to call it. So since each of them are different in terms of what those services are, and the point of them is that they're multifaceted and designed to be able to provide you the services you need along your journey into aging, we're not going to talk about it because all of the other things we're talking about might be part of a CCRC. All right, and then our last option for long-term, lower level of assistance is adult day programs and senior centers. So when it comes to the cost of adult day, Medicaid may pay for this, but you probably, or maybe I shouldn't say probably, you may have to go through a waiver program in addition to meeting certain requirements. Because adult day is not generally considered a medical need, it's more for socialization, supervision, caregiver breaks, things like that, and also intended to keep individuals in their homes instead of moving to a facility. That care is not necessarily medically necessary, and those facilities don't often provide medical care unless it's particular types of adult day, which go back to options and acronyms if you're curious about the differences. But because of this, it's unlikely that Medicare will cover adult day services. That's a wrap, at least for today, for part one. Part two will come next time. But just in quick summary, in general, Medicaid and Medicare are health insurance programs. This means that they, for the most part, cover things that have a medical necessity to them. And that means that they don't necessarily help you out with room and board or social enrichment programs. Today we covered Medicare and Medicaid coverage for both short and long-term stays in a facility with a lower level of assistance. Next time, we'll cover Medicare and Medicaid coverage for both short and long-term stays in facilities that provide a higher level of assistance. My name is Jessica Zawadski. I am the program specialist here for Elder Watch. Thank you so much for joining me, and we'll see you next time. Bye.